Hi, so I am going to be doing the trach care video. So we get started. So obviously when I walk in the room, I'll say, "Hi, my name is Taylor. I'll be a nurse today." I'll ask for two providers, and say name, date of birth. And then I will make sure that I always provide privacy before I do anything because I want the patient to feel comfortable and during the whole procedure. Then I also want to verify my provider's orders and make sure that I'm doing the right thing for my provider. So as I'm getting everything set up, I'm going to be telling the patient they can ask questions whenever they need, and I will answer their questions. I will tell the rationale of why we are doing the trach care sectioning to make sure that it's clean and there's no reservoir for infection, and that we just want to make sure everything's in tip-top shape for the sectioning care. And then as always, we always want to ask for verbal consent for whatever we are doing and for us to continue for our procedure as well. Okay, so as we always do, we always want to raise the bed to our hip level to make sure it's in our sterile field and that we don't want to break the sterility of what we're doing. Whenever we do this trach section, we want to make sure that our patient is in Fowler's position or semi-Fowler's position. Just make sure it's comfortable and that there's no, that the suctioning and it'll work properly in that position. Okay, so my patient is placed in the high Fowler's position. So before we do anything with the trach sectioning, we always want to make sure that we also take the lungs and make sure that we have a baseline of what the lungs are sounding like so we can hear any abnormalities of the lungs and if they sound bad or good or whatever. And then also protocol, you have to increase the oxygenation levels as well while you are doing the trach care. Okay, so while I'm getting started, I would do my PPE. I would wear mask, gloves, gown, and then I would do my hand hygiene. So I'm getting my supplies prepared here. Let me put this down so you can see more. My supplies are getting prepared. Put my PPE on, mask, gowns, eyewear. Okay, so that my gloves, my sterile gloves are right here. My suction kit is right here, and my saline basin is right here. Okay, so then I'd pour my sterile saline into this basin right there. Then next what I'm going to do is I'm going to don my sterile gloves. Oh my goodness. Okay, it's not perfect, but I can fix it. Okay, so now scoop under. Sterile still. Okay. All right, so I have my sterile gloves put on. Now I'm going to get, that's gonna be moved out of the way. I wouldn't touch that with my sterile gloves either, by the way. I put that on, okay. Prepare my sterile field. The 1-inch border. Border around it. Okay. And then I have lack of space, so it's kind of hard to stay sterile on my lack of space, but you would only have 1-inch borders and you make sure you have in the sterile field with lack of space. And then I will get my suctioning out and I will coil it in the dominant hand that I'm using. So I would coil it in this hand. Make sure I have it right there. Coil it. Okay. So I have it right there. Ooh. Okay, so with my non-dominant hand, I'm going to turn on the suction and I'm going to regulate it from between, adults is like from 100 to 110, 115, 120, I believe. And then with a non-dominant hand, I'm going to turn on the suction. Okay, so turn on the suction. And I have my suction tubing in my dominant hand because this is what I'm going to be using for my dominant hand. So I dip the catheter that's in the moistened so it's easier to be inserted into my catheter, which is going to be right there. Oops. So I dip it in there in the suction, and then I am going to apply my suction like intermittently in the trach until I hear them cough. And then I'm going to take it out approximately like around a half an inch, and then I'm going to apply suction like intermittently throughout their trach care. So then I'm going to start inserting, and then it'd be suctioning. So I'll have it like this, and then I will keep doing it until I hear the coughing, and then I hear her coughing. So then I'm going to intermittently do it. Ooh. Intermittently. And then I have to do this for 2 times. So I do a total of 2 of the suction passes. So I repeat those steps again after I removed the trach mask. Okay. Oops. All right, so I did that, and I will take out the tubing, and I will discard all my catheter supplies in the appropriate bin. And while I am discarding it, I want to make sure that I am assessing my tubing that was on my catheter. I'm going to assess COCA. So COCA is color, odor, consistency in the amount that was on the tubing. So I want to make sure I'm looking for any abnormal coloring, any purulent discharge or blood or anything of that sort. So I'm going to remove all of that, and then I'm going to take my gloves off and discard my gloves into the proper bin, perform my hand hygiene. Okay, and now I'm going to open up my trach care kit. So here's my trach care kit. Ooh. And then for this, you only have to don 1 sterile glove this time. So putting my 1 sterile glove on. And I didn't touch that, but it's hard to get them on after putting Trach on. All right. I have my pre-moistened cotton tip. Sorry, pre-moistened. So then now what I'm doing with my non-dominant hand is I am going to remove the trach mask and with the inner cannula, and then I'm going to gently insert a new inner cannula into my patient's trach. So I'm gently inserting the new nasal cannula to the tracheostomy. Ooh, curvature, and I'm making sure that it fits, it is secure, and then I make it lock in place. Okay, so then next I'm going to be using my cotton moist tips. These are my cotton tipped applicators out of the cannula, and then I'm going to use my sterile hand to clean the outside of the nasal cannula. So I'm cleaning, I don't have a nasal cannula, so I'm cleaning the outside of the nasal cannula. Just using a circular motion. Okay, so then I'm going to make sure that my nasal cannula is stable, and then I want to make sure I place the dressing, the fenestrated dressing underneath it, which is this. So I would place it underneath it right here for comfort, so I wouldn't have any skin breakdown or anything of that sort. So it would look like this, like that, and the trach would be right there, and it would go like that. Ooh. The dressing's right there. And then when you put the dressing in there, then you'll have to do your ties. So when you do the ties, you're supposed to make sure that you keep the old ties on, and then you'll tie the new side on and wrap it around, and then tie the other new side on, and then take off the old one. But I don't have anything to tie this on, so then you would use the normal tie to tie on. But I want to make sure that you don't take off the old tie before you put the new one on. You take the old tie, keep the old tie on, put the new on, and then take the old tie off when you have the tracheostomy, when you're changing it, to make sure it's stable and you don't want the tube to come out and so forth. So I would get all that ready, and it'll be tied throughout, and then I would make sure that old ties are in place and so forth. And then after that, I will make sure I fasten my Ew, those gloves smell. Fasten the ties on each side. Make sure they're secure, that the trach is in place. And then I will make sure I discard of all the stuff that I was using. Ooh. And then also, of course, I'd always do hand hygiene. I would make sure the bed rails are raised up, bed is in lowest position, the call light is in reach. And then I just perform my hand hygiene. But in my hand hygiene, and then I'll thank them for cooperating with me in the procedure, and then I'll assess if they need anything else or how they're feeling, and then they'll tell me, and then I'll be like, all right, thank you, and I'll be done.